Welcome to the Woodlawn Report. I'm Khrista.
I'm Brad Rogers.
And we're here to talk about what happened recently at our board meeting for November. I wanted to say October. It's hard to...
Well, we're always talking in November, but it's typically about the financials and stuff from October, so it is sometimes confusing.
Right.
Yeah.
So first off, you've been working on this a ton, but can you tell me, where are we with the Rural Residency Program? And remind our viewers, what is a Rural Residency Program?
So a Rural Residency Program or Residency Program is a training for physicians that have already graduated medical school, which means they've completed at least 8 years of school already, and they are doing their residency. Residency means that they're going to spend 3 years, typically minimum, at a facility with more of your on-the-job training that is reinforced with book learning, and they call it didactic training, but that's kind of more the regular classroom presentation type training. Mm-hmm. And so we received a grant about not quite a year and a half ago that is helping us work through that process. Everything is going very nicely. We've partnered with Marian University, their School of Medicine there, and happy to say that they recently got the approval as our sponsoring institution from the ACGME, which is just an acronym for a agency that makes sure that schools are setting things up to meet all of the recommendations and requirements for whatever that particular training program is. And so that was the big first hurdle. Next, you will see coming up in a few months, we will have a job posted for a family practice physician, board certified family practice physician, who will become the program director. And so that person then will be responsible for setting up and ensuring that the residents work their way through that 3-year process. And really that goal is to make sure that those physicians get all of the minimum requirements met in the types of patients they need to see over that 3-year period of time to become a family practice physician in a rural community. And so we're very excited. We're one of only 2 programs in the country that have worked towards this process in a small hospital like this. The one's up in Wisconsin. And so fall of 27 or 28, depending upon how the accreditation dates work, we will accept our first class to the Woodlawn Family Practice Residency. And so we're looking forward to that. We've still got some hurdles to get through, and they can always throw you curveballs, but everything is working in the right direction, and we look forward to being able to start training some docs right here in Rochester, Indiana. It's huge for not only Woodlawn, it's huge for the 3 and 4 counties that surround us too. Doctors that are trained in rural communities are much more likely to live and work in rural communities. And our community, as well as 2 or 3 around us, are in a medically impoverished area, which means we do not have enough doctors for the number of residents. And that is only getting worse as more and more people hit that age of retirement. You know, those boomers, they call them. They keep retiring in record numbers. Well, that boom is causing a challenge with the number of physicians we have. So we're very much looking forward to that. We also don't have enough residency slots in Indiana to meet the demands. And so schools have got to start accepting more students so that those residents don't leave, because once they leave the state, the percentages of them coming back starts to drop significantly.
Well, and I believe to our other states, we have a lower number of medical colleges.
We are already shorter than all of the states around us as far as the number of slots available. So we need not only these 3 or 4 slots that we're talking about, but we need another 40 or 50. And so that is something that the state's been working on for several years.
Yes.
So very exciting.
Very exciting.